If you're having a baby in a place where gas and air is available, which in the UK includes all hospitals, birth centres and home births, it's a good idea to know how to use it effectively. So when you have a contraction starting, take a really nice deep breath of gas and air and then continue to breathe it slowly and steadily as your contraction continues. Your contraction will be growing in intensity until it reaches a peak and is very, very strong, and you want to be breathing your gas and air all the way through that. As soon as you feel your contraction starting to ease off and that intensity die away a little bit, take the gas and air away and just breathe the air. And that way, your gas and air will be coming out of your system at the same time as the contraction is fading away, so that when your contraction ends, there's no more effects from the gas and air in your body. If you allow that to happen, then when your next contraction starts, you'll really feel it starting, and so you can start breathing from the gas and air again. The challenge is, if you're finding the gas and air effective, you may not want to stop breathing it after the contraction is past its strongest bit. You'll want to breathe it right to the very end until the contraction has completely disappeared. The risk of that is that if you breathe it to the very end of the contraction, the effects continue beyond the end of the contraction, and when your contractions are close together, your next one may have started and you won't really notice because you're still slightly numb from the gas and air. So when it wears off and you suddenly realise you've got another contraction starting and you start breathing it, it doesn't have quite the same effect because you haven't managed to keep in the right flow of keeping them going at the same time. So breathe your gas and air from the start of a contraction, but stop breathing it when it reaches the peak and it goes just past the peak and starts being quite a bit less stronger, and then you'll be all set up ready for the next contraction to begin and ready to start breathing it again.